everybody. It is Liesl and Brad here. I'm going to give everybody a second to come in. I don't have anybody in here yet, but we are going to start off with some frequently asked questions. Hello, one person that you are in here with me. If you are a real person and you are here because you want to hear about labor and delivery, can you tell me how pregnant you are and where you're from? Oh, hello, we got some more people in here. Hi, guys. So if you're just joining me, hello. Can you drop in the chat where you're from, how many weeks pregnant you are, if you're postpartum, wherever. Oh, everybody left. Okay, never mind. Maybe everybody's... Okay, well, Brad, I guess we're just going to sit here and wait. While we're waiting, I figured I would talk about some things, some questions, some frequently asked questions that I get in my DMs. Let me just find my notes. Let's see. Oh, here we go. Hello. Waiting on some people to come in. Hopefully the email got sent out and the DM blast. Hello, person that is in here with me. I don't know who you are, but if you have a question about labor and delivery or pregnancy or postpartum, I am happy to answer it. And I'm here for the next 20, 30. Oh, okay, you're gone. Brad, we're just going to sit here and wait for people to come on in. Let's see. La, 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 la. La, la, la. Okay. Okay, well, while we're waiting for people, Brad, even though it's just me and you, why don't we talk about some of the frequently asked questions that I get? Because even if nobody comes in here, it's useful, right? Somebody can watch this later. So I figured I'd start off. It's kind of funny just being here by myself, but I figured I'd start off this live talking about poop, because poop is one of those subjects that it's kind of awkward, but it doesn't have to be awkward. And poop is always, it's poop and tearing. Those are my two things that people are most concerned about when it comes to birth. Poop. Am I going to poop? Where's the poop going to go? Are we going to smell the poop? Is it going to be what's going to go on, right? So we're going to talk about poop. We're going to talk about postpartum pooping too. I figure that's a good thing to kind of start off with. But yeah, poop and tearing. Pooping and tearing. Those are the two things that people like to ask questions about. So pooping, Brad, I usually, when people ask me about pooping, they want to know, well, they mainly want to know, like, am I going to poop and what are the chances of me pooping? Oh, hello, one person in here with me. I'm just talking about pooping. So, oh, they're gone. Okay, never mind. So anyways, poop. I'm just going to pretend like nobody's here. Anyways, poop. Usually what people ask about is, am I going to poop? Or, how much is going to come out? Is it going to smell? Blah, 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 blah. Right? And the thing that I tell people is, number one, if you poop, it's actually a good sign that you're pushing in the right spot, right? Because if you think about your anatomy, your vagina and your rectum are right next to each other. Hi. Oh, hi. Hi, Ashley. Yes, I can answer that in just a second. Let me finish my poop question. But if you think about poop, right? Your rectum and your vagina are right next to each other. So if you're pooping while you're pushing, it's actually a good sign because your baby's right there, right? You're trying to push your baby out. And so anything in that rectum is going to come out. So that's why I tell people it's actually a good sign if you poop a little bit while you're pushing, because you're usually pushing in the right spot. Okay. Hi, Ashley. And hi, other few people in here. Let me just get to my notes here. Okay, so Ashley wants to know, how do I flip my baby? Hi, Jenna. How do I flip my baby? He is transverse. How many weeks pregnant are you, Ashley? Can you tell me? I have a good ebook for you to read if you are not too pregnant. 35 weeks. Oh, perfect. Okay. Have you done anything yet? And have you looked at spinning babies or anything? Are you familiar with spinning babies? Tell me what you've done and then I can give advice. No, not yet. Okay. So I want you to Google spinning babies. Let me find their ebook. It's about $10. They have a lot of free resources online, but they have this like $10 ebook that I love to send people because it is like a whole little thing that you can follow that they give all these like day 1, do this, day 2, do this, right? And you're at the perfect week to start doing this. So let me find it for you and I will drop it in the chat. Ebook breach. Here it is. Okay. Oopsies. There you go. So that's a little ebook. It's $10. They have all of that same like information all over their site. So if you go to spinningbabies.com and you start just like looking through their site, right? They have so much info about how and what to do to spin your baby and try to get baby into a or head down position. But I like to send that ebook to people because it's just like, you know, it gets rid of like you having to like sort through all these things. So you can go to their website and filter through all the things and like search, right? Or you can just buy the ebook and it'll tell you exactly what you need to know. So definitely check that out. But you are at the perfect spot right now to like start doing the things. Sometimes people wait too long, right? They're like 39, 40 weeks and they're like, oh shoot, my baby's still breech or my baby's still transverse, and they start doing things. And it's a little bit too late because their babies aren't right. But 35 weeks is perfect. So definitely check out Spinning Babies. They will be a great, great resource for you. Okay. Annie says, I signed up for your labor class and my bank account is in charge, but I still can't see the course when I log in. Is there something else I need to do? Oh, I'm sorry. It might be that your email, sometimes we've had people type their email in wrong or it's like connected to a different account. Do me a favor and send an email to Jenna at support@mommylabornurse.com and she can help you with that because I bet it's just some kind of technical error. I'm sorry that you can't get into the courses though. That's annoying. It's probably just like something we need to, you know, change your either email or like change your account. So if you do that, we'll get you squared away. All right. So everybody else who's in here, if you want to drop like how many weeks you are, where you're from, if you have any questions, I am here for the next, 20 minutes or so, 15, 20 minutes. I'm a little under the weather today, so I don't want to do like a whole hour, but I am here if anybody else has questions. Happy to answer. Okay, Keith. Hi, my name is Karen. What will happen when I go into labor? What will happen when I go into labor? How will I be laying in the bed? Oh, and when will my doctor know when the baby is ready to be born? Ooh, love that. Yes. Karen, I would say, how many weeks pregnant are you right now? Are you like right at the very beginning or are you like right at the very end or like where are you at in your pregnancy? Tell me. And then we'll answer Sydney's question too, because I was going to say a good thing to do is just take a course. We have a great course and also we're having just a little sale today. You can use the coupon code 5OFF to save $5 on course enrollment. Secret. I'm going to put it in the chat. 5OFF. Oops. 5OFF coupon. Because that question will probably be fully answered after you take a course. Coupon for $5 off. And I'm going to drop the link to our courses too. We have the most affordable birth class out there. I'm very proud to say that. We answer all of those good questions. That's why I love doing these lives, but it's also like, I'm like, oh man, if we just take a course, right? Then, or we just watch all these lives, right? You're like, oh, I don't even have to ask this question because like I know all this stuff now. Here, let me send you a link. Here we go. Okay. OMG Jenna is 20 weeks. Sydney says, hi, I'm 35 weeks as well with baby in frank breech position. I started acupuncture and Moxa stick treatment last week. I don't even know what that is. Interesting. Sydney, I will say, check out the same resource that I sent. What was her name? Ashley. The Spinning Babies ebook. It's like a little ebook, like a $10 ebook that you can buy from Spinning Babies, and it tells you everything you need to do to like. They have like a 95 or 96% like flip rate. So it's a really good. I love sending people this ebook because it works so well, and it's just laid out so well. So definitely check that out. Okay, let's see. Ashley says, should I do your course? I missed mine at the hospital due to snow and ice. My first was planned C-section, trying to do feedback. Oh yeah. I mean, up to you, obviously. But yeah, especially if you missed your hospital classes. Our class completely will teach you everything you need to know from like a hospital class. It's just, some people prefer to go to the hospital or do like an in-person class because they just like in-person learning. But our class, it covers all of the same information. So if you don't mind online learning, like you'll get the same info. It's just a different experience, I guess. So yeah, and you can save $5 with the coupon code $5 off. All right, let's see. Diana says, my doctor won't sign off stopping work before my due date, and my job is very physical. I have a month left and I'm struggling very much. What are my options? I'm sorry. What do you do? Is there anything you can, I mean, I guess you can't can you talk to your boss? Maybe? Is there something you can, yeah, I would want to know what you do. Because that's hard. I get that. Like if you have, I don't know, if you are moving around all day, right? Is there something that your boss can give you different work to work since your doctor isn't able to write you a note? That would be my question. Let's see. Okay, Lorena says 35 weeks today, having a C-section at 37 due to placenta previa. Second birth, but first C-section, so very nervous. Ooh, yeah. In regards to breastfeeding, do you recommend bringing my pump to hospital? Also, make sure I'm using the right size flange or stick to the hospital pump. Okay, so you definitely don't have to bring your pump to the hospital. I wouldn't even, I mean, if you want to, just to get experience using it with like a potential lactation consult, because a lot of times they have lactation consults at the hospital, but I usually tell people that's a little bit excessive, like no need to actually bring your pump to the hospital. Because it's like one extra thing you have to do, right? And they do have, most of the time they have pumps there that you can use. But yeah, or sometimes what I tell people to do is just take the flange, just take the flanges. Especially if you're just questioning whether the flange is the right size, like they can do a flange measurement at the hospital. Let me send you this video about flanges because that is a big misconception, or not misconception. That is a big thing that people get wrong. They think that they need way bigger flanges than they actually do. So let me send you, trying to think. Let me send you this flange sizing video that I did a while back. And that, use a flange. Here it is. Oh, okay. I think this is it. It's not opening, but I think this is it. That will be very helpful with flange sizing. But yeah, I would say don't bring your whole pump to the hospital. Maybe just bring the flanges if you're, and also view that video. Let me see if there's anything else. Having a C-section due to second birth, the first C-section is very nervous. Yeah. Let me also send you, I have a really good article about C-sections and like the whole process. In the course too, we have a whole, it's called Birth It Up, the C-section series. If you purchase Birth It Up, you get access to like, it's kind of like a couple different pathways, but I have a whole course that just like goes over what a scheduled C-section is. So if you're more interested in just like getting the whole experience right, go and just, enroll in Birth It Up and go through Birth It Up, the C-section series. But let me send you this article as well. Hold on one second and I will find it for you. C-section. Here it is. But yeah, this is a good little like starter, I would say. And then if you want even more information, enroll in the course. And here it is. That is that C-section one. Okay. Let's see. Court W9 says, I'm 3 weeks postpartum and trying to exclusively breastfeed. I have one inverted nipple that's very painful with a crack that doesn't seem to heal. Is it okay to use a nipple shield without causing nipple confusion? How long? This is a question for a lactation consultant. I will do my best to answer it, but unfortunately, I'm not a lactation consultant, so I can't give like really good lactation answers. But yeah, I would say reach out to, like, even this question is hard for me to answer because lactation consultant is so helpful in person because they can actually see what's going on and they can like help you in real time. So I would say, I know it's kind of a pain in the butt to have somebody come to your house and blah, 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 right? But sometimes you can find lactation consultants who even do like Zoom consults, and they can like kind of watch you breastfeed too while you're doing that, and they can help in like real time. So that would be my best advice there, is you need like an in-person person or like a Zoom person actually seeing what's going on while you're breastfeeding, and then they can help like in real time. But I wouldn't worry as much about the nipple confusion with the baby. Sometimes people get like way too focused on like, oh my God, it's going to, right? It's okay. The baby will be fine, right? We got to make sure that you can actually breastfeed first. So that's my best advice there. Okay. Let's see. Diana wants to know, when I fill out my birth plan, just started your course, 34 weeks. Hope I'm not starting it too late. Nope. Perfect time. How do I know what position I want to deliver in? It's my first pregnancy. I would not even, I think those are on the birth plan. Keep going through the course and then do the birth plan. That's what I would say. Because you don't even like, I feel bad that you're like, I feel like I need to know what position I want to deliver in. You don't necessarily have to make that decision right now or even like think about that. Yeah, that's kind of like birthing positions. I would say, I mean, obviously I can give some education or like advice on what are not right and wrong, but like what are better pushing, positions. We talk about like gravity, right? Not pushing on your back and all this stuff, right? But yeah, don't feel like you have to know the exact position that you want to give birth in, because a lot of times what happens is in real time, right? We think beforehand, before we come to the hospital, before we give birth, we're like, okay, I'm going to give birth in hands and knees position. And then you get there and you're like, actually, because that's what happened to me actually. So I was like, okay, yeah, I want to give birth in hands and knees, or I want to, give birth side. I don't want to give birth on my back, right? But when it came down to it, I had such terrible back labor. And so I remember with my first one, I was like pushing on hands and knees, and I was like, I cannot do this. I cannot do this. It's so painful in my back. And I wouldn't have known that beforehand. I knew that in real time, right? But it's kind of one of those things where you keep your options open, and you just kind of have to see how your birth goes. But yeah, I'm sorry that you feel like you need to know that beforehand, because you don't. Okay. Jade wants to know, whoops. 40 weeks, I have sharp pain in my belly button area and just below. Is this diastasis? Oh, When you say sharp pain, so anytime somebody says sharp pain, I have to say, I would check with your provider about that, because sharp pain can be lots of different things. It can be something really serious. It can be something not very serious, like gas, right? So it could be diastasis recti. I would say probably not. But unfortunately, that's something that I can't. Yeah, it's hard to know. So I would say, yeah, especially if it's sharp pain, definitely talk to your provider about that. I'm hoping you're still feeling your baby move around, and all of their good, like you're not having any bleeding or anything, because obviously like sharp pain, and if your baby's not moving around as much, right, or you're having bleeding, like that can be a real emergency. But yeah, it's hard to know. I'm sorry. Okay. Let's see. Here's Karen again. Hi, my name is Karen. How will I know when I'm in labor, and how will my doctor know when the baby is ready? Oh, I already answered that one. Hi, Bertha. Hi, I'm 32 weeks and my baby is weighing big at 91%. My OB said I might need to have a C-section. Is there anything I can do to avoid that? Had my glucose test done at 25 weeks and everything was fine. I would say there's nothing you can do to, like, your baby's going to measure what your baby's going to measure, right? So I wouldn't say change your diet, change all these things, right? Did you get diagnosed with gestational diabetes? That would be my question that I wanted to know from you, because there are some dietary things that we can do to help in that regard. I'll wait for you to answer me on that, and then I will. Let's see. Answer. Denise says, I'm 36 weeks with my second, hoping to get she said no. Okay. No. Okay. My OB said I might need to have a C-section. Is there anything I can do to avoid that? Have my glucose test done at 25 weeks and everything was fine. So yeah, if you don't have gestational diabetes, you might just have a big baby in there. I would say I'm concerned that your provider is already telling you, oh, you might have to have a C-section. That's something that providers should not even, I'm sorry that even got thrown around, because that's not the only, like, people have big babies, 90 some percentile babies all the time. And so I'm sorry that your provider has like even inserted that into your brain. So I would say plan on having a vaginal delivery unless, yeah, that's a hard one to answer. I'm sorry. I'm glad you don't have gestational diabetes though. Okay, let me go to Denise. I'm 36 weeks with my second, hoping to get a membrane sweep next week. How often does this actually work? Having been having period-like cramps for the last couple of days, lower back pain, more BMs, hoping this means something happens sooner rather than later. Yeah. I'm surprised they're also giving you a membrane sweep at 37 weeks. That's kind of cool. But I'd say membrane sweeps, especially at 37 weeks, it's not going to throw you in. It's probably not going to throw you into labor, but it might stir things up. That's kind of what a membrane sweep and any sort of thing that we do to put ourselves into labor, right? Or to get to induce labor. That they're sorry, let me start over. Whenever you do something like a membrane sweep, bouncing on your labor ball, whatever, drinking red raspberry leaf tea, whatever, right? I don't like to tell people like, this is what you do to put yourself into labor. We're just preparing our body, right, for when our body is ready to go into labor. Okay. So a membrane sweep, it's like, half the time it works at really getting things going, half the time it doesn't. At 37 weeks, I would say it's a low chance that you'll go into labor, like I said, but it might stir things up. And this is a good time also to start doing all the other things too, to get your body really prepped and ready and going. So I'm going to drop, this is now the third time that I've dropped this induction worksheet in this live, which now I feel like I should just drop that at the beginning. So, because a lot of people have questions about inductions, or like inducing labor. And this is a really good resource to send people. Let me find it. Induction. There it is. Oopsies. So this chart that I am about to drop, there it is. This chart that I'm about to drop, it's really great because it has like, let me find it. It has like what the method is, right? How does it help? How it's done? When is it safe to start it? Is it evidence-based or anecdotal? So it has all these things, and you can just, if you click on it, you'll see what I'm talking about. And yeah, just start doing all the things. Get that body ready for the baby to come out of it. All right, let's see. Got syllabs 3281. How do you know if you are fully healed on the inside after a C-section? Is it just being able to move around more? Also, my husband and I watched your video, had our daughter 120725. Aw, glad I could help. Yes and no. Yeah. I mean, it takes, I think, didn't we post, Jenna, the other day on like on the feed that it takes something like actually a year or 2 years to fully heal from birth. So it's hard to know. I mean, you're definitely not going to be healed by 6 weeks. But yeah, it's dependent on you, right? And your health and your anatomy and how many babies you've had and, what's going on in there, right? Everybody's going to heal a little bit differently, but also just knowing that it's major surgery. It takes a long time to heal, and you also are taking care of a baby. So yeah, it's definitely going to take longer than 6 weeks. All right, let's see. Okay. All right, guys. If anybody else has questions, I'm happy to answer. But if not, this was good. Sorry, like I said, I'm a little under the weather today, so I'm a little bit just kind of off. And I also have the kids this week. So whenever I have my kids, it's like I'm a little bit, right? So next week, I'm going to do another live. Maybe I'll do 2 next week. I don't know. And I like to do them at night too. It's a little bit harder for me to do them during the day because I have a lot of stuff going on during the day and I have kids, all these things. But yes, I would love to do this again next week. I'm really excited to just get more into YouTube because YouTube is fun. But thank you guys for coming to this one. I'll be sure to send an email out again and a DM blast. I don't know where you guys, if you came from the DM blast or you came from email, but yes. We got one more question, then I'll head off. Another question. First time mom, how long does milk come out when you are pumping breastfeeding? Well, it's actually, I said, well, it's actually like a well, right? It just, when you pump or when you breastfeed, right? When the baby is first latching on, right? It's kind of like opening up a hose, right? And it's like, go, 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 right? And then it kind of slows down, right? That's called a letdown, right? Because your baby latches on or your pump latches on and you kind of like you're like opening up the hose, right? And so it's coming, right? And then it kind of slows down and it kind of goes to like this trickle, right? And then sometimes people have second or third, we call them letdowns. And it comes out kind of fast again, and then it kind of slows down. And you actually, I don't know if this is fully true, but this is just what I've witnessed. You actually, as long as you have that pump on or as long as you have that baby latched on, you're always like, it's always going to be at least coming, even a drop, right? Because when your baby is on or your pump is on, it's telling your body, hey, I need more. Hey, I need more, right? So your boob, your body's like, oh, okay. So at the same time, it coming out, your body's like, okay, I'm trying to make more, right? So it's like this constant cycle. Um, so as long as your baby's latched on or your pump's on, milk's gonna be coming out. It just might not be coming out like this steady stream, right? It's usually what I see. People get a letdown or 2 letdowns or 3 letdowns in this little pumping session, or breastfeeding session. But as long as something's saying, I need more, you're going to have even just a couple drops coming out. Kind of hard to explain without a boob in a like a diagram or like an actual baby. So I'm sorry if that was a little bit confusing, but yes. Okay, guys. All right. I'm going to hop off. This was fun. Again, sorry for the time change. Oh, thank you. Missed it, but just want to say hi. 24 weeks tomorrow. I feel like I have a little bowling ball sitting in my lap all the time. Yeah, sounds about right. Oh, yes, I will be on next week and I will be feeling better, hopefully. And we will be back and we will do this again. Probably do it at night, be a little bit more relaxed. So, yes, all good things. All right. Bye, guys.